Something else we do in my practice is if you start to see developmental delays, you stop all further vaccination. I've had so many patients join my practice who, their pediatrician says, oh no, there's no link, just do them all. And even when the child's starting to show signs of a problem neurologically, they're continuing on. And it's reckless. So we had in our group 1 who followed the vaccine-friendly plan, 3 kids who were starting to look headed down that autism road. Mm-hmm. They weren't quite severe enough to have a label or a diagnosis, and by stopping, they ended up being completely normal. Kids are hurting. People are hurting out there. When you over-vaccinate and you overtax the immune system at a very young age, you shift people towards allergy and autoimmunity. And the chronic diseases we're seeing today are partially due to that very issue. So we've got to change what we're doing. We've got to individualize medicine. We cannot do one-size-fits-all medicine anymore. My son says, Dad, you got a lot to say. We ought to get you on YouTube.
Yeah, let's get this stuff out there.
Yeah, and I'm going, I don't think so, son. He's like, come on, please, it'll help me. I'm just trying to learn and how to do this, and so I did it as a favor for him. And
right.
We had a couple videos that were doing well, a wart video, and then my wife walked in. I told you that story. Mm-hmm. It was a Saturday. She said, I got something in my ear. I think it's wax. And my son was here. He says, wait, we're going to film this.
Yeah.
I said, okay, whatever. We were kidding around, and it was this sort of combination of cute and gross.
Right.
And that thing's got 20 million views.
It's incredible.
Yeah, you can, on YouTube, you can just put earwax and pops up in the top 5.
That's awesome.
Yeah.
Well, Dr. Paul, before we start, I just want to have a moment of gratitude because when I first met you in 2001, my wife we were talking about having a baby, right? And you gave me this sheet. This was it had a lot of sense to it, a lot of science, and you said, you know what, this vaccine has a lot of aluminum, I wouldn't do this, I wouldn't do this, and now you have this wonderful book out that comes out by the time folks watch this, the vaccine-friendly plan. So I want to commend you and also, again, extend gratitude, because without that sheet, I would have been lost, because there's not a lot of science, there's not a lot of practitioners out there that understand this. So first of all, thank you for giving that to me way back then, and congratulations on the book.
Thanks, I appreciate that. Yeah. As you probably know, since 2011, when I gave you that sheet, there's been a huge change from the CDC with regards to a recommendation for pregnancy, which is the Tdap. Mm-hmm. So I would have put on that sheet a very big no Tdap.
Yeah.
I'll tell you why, in case you wanted to know.
Yeah, let's talk about it.
Since you brought up pregnancy.
Yeah.
It's a pet peeve of mine. Mm-hmm. Every day in my office, almost every day, I have a new couple sitting. They're excited. They're about to have a baby. Mom's just ready to pop, and they want to do what's right for their kid. And they're wondering about this vaccine issue. And in pregnancy, if you go back a couple decades, it was a sacred time. I mean, the womb, you don't put toxins in your body, right? Mm-hmm. I mean, you eat organic, you avoid medications. You don't drink, a lot of things we would do to keep those unborn child protected from toxins. Yeah. In 2013 and big push in 2014, the CDC came out with the recommendation we're going to inject a Tdap vaccine, mainly because of the pertussis component, to every pregnant woman in America. So almost 4 million unborn children are getting exposed to a huge dose of aluminum at a neurotoxic dose. So the FDA has a document that's live today that says don't exceed 5 micrograms per kilogram, especially in premature infants, because they found, studies showed it caused developmental delays and brain problems. Mm-hmm. And somehow that information is being ignored. Now I'll tell you why they're ignoring it. The theory is we inject mom, she's going to develop antibodies against pertussis, give it to her baby who's born with protection. It's probably a true theory, and it might reduce the risk from 5 to 10 deaths per year to something lower than that out of those 4 million births. In my way of thinking, however, is it worth poisoning 4 million babies, unborn babies, to potentially save 2, 3, 4, 5 lives? Mm-hmm. I don't know. I don't want to make that decision for anybody, but if it was my kid, if my wife was pregnant, there's no way I'm guaranteeing a poisoning for that 1 in a million chance it might help my baby.
Right, because 600 micrograms of aluminum, and you said the adult daily maximum is 5 or 25?
So adult daily max is 50.
Oh, 50, okay.
The per kilo dose is 5 micrograms per kilo. So that unborn child is definitely like less than a kilo. You shouldn't give more than 5 micrograms. The vaccine has 250 to 330 depending on the brand.
Wow.
It's a ridiculously toxic dose.
Right, and so the thinking must be by the manufacturer or the regulatory bodies that, well, that mercury is not crossing the placental barrier, which we know that a lot of things, heavy metals and so forth, cross, right?
Right, aluminum
Yeah.
in this case. Yeah, they got the mercury out. This is aluminum. And we just don't have long-term studies. So what we would need to do, and of course the American population is the study, is have a huge group that's not getting this vaccine and a huge group that is, and follow those kids over a 5, 10, 15-year period, because it takes time to see chronic problems from low-dose toxicity. Those studies haven't been done. So, each mom in America is part of the study if you elect to have that vaccine.
Yeah, and let's talk about that, the dearth of studies, the lack of data. It's really surprising. I mean, a lot of folks, when we think about drugs that are prescribed through physicians, we think of randomized placebo-controlled trials. But what's really interesting is the filing, and I learned this from watching the movie Vaxxed, which I would encourage folks to recommend, no matter which side of the spectrum they're on. Vaccines have this little loophole where there's recommendations and there's not a lot of safety studies or data. Can you talk about that?
Well, there's lots of studies,
Yeah.
but what's missing are the randomized controlled studies, as you mentioned. Vaccines sort of get a special privilege and kind of a fast track. We really need to do proper placebo-controlled studies. The classic one that's just very upsetting to me is the HPV Gardasil vaccine that's being given to teenagers to prevent cervical cancer in women. The package insert from the company that makes that vaccine, it's all laid out for you. They used, except for one tiny subset, they used aluminum at very high doses, the same high doses that are in the vaccine, as their control. So there is no control. And then, of course, their outcomes were the same. Well, of course, you injected the same amount of a huge toxin to both groups. Make matters worse, in that particular study, they stopped it at 3.5 years, long before you could ever determine whether it was actually going to prevent cervical cancer. It's a hypothesis. But that's what's missing, long-term, good placebo-controlled studies. What we need for vaccines is what we did with tobacco. So I was born in 1957, the year the US government started the huge millions of people, non-smokers versus smokers, and they followed these people for decades. Well, we all know, right? Tobacco is not a really good thing to be doing. You're going to increase your cancer risk. We need that same sort of dedication and commitment from the government, from the CDC. Take a huge sample of non-vaccinating, a huge sample of partially vaccinating, and a huge sample of completely vaccinating, and follow these kids for 10, 15, 20 years. Look at the outcomes. There are clues in the literature. JAMA, Journal of American Medical Association, in 2013 published a study from Norway. 80,000 pregnancies followed for an average of 6 years. Half the kids, the moms took folate, half didn't. The autism rate, if you took folate, was 1 in 1,000. 1 in 500 if you didn't. Now this is at a time when the US, the autism rate was 1 in 100. 1 in 1,000 in Norway, 1 in 100 here. Why? Well, the study wasn't designed to address that. It's just I throw that out to the viewers. If you're a thinking person, you're going to go, I wonder what could that be? Since I think it's really an issue of toxins, I'm thinking, okay, what toxins do we have in the US that they don't have in Norway? Well, GMO is banned in most of Europe, so there's one exposure. But the other one was the hepatitis B vaccine for newborns, which we've been doing in this country for almost 20 years. They don't do that in Norway, and in fact, in most other industrialized countries, you only give the hepatitis B to babies who need it.
If the mother has it, for example, right?
Exactly. So you catch hepatitis B from sex and IV drug use. Babies don't do that. Babies can get hepatitis B if their mom has it. And so those babies should definitely get the vaccine, and H-big as far as that goes. But in the US, the CDC says 1 in 100 moms have hepatitis B, I've read other studies where it's more like 1 in 1,000. So that means we're injecting a 250 microgram toxic dose of aluminum to either 99 out of 100 or 999 out of 1,000 infants for a disease they're not at risk for. And it just flies against common sense.
Yeah, and last time during our autism intensive interview, you talked about the immunity that's conferred through that early life vaccination only affects like 20, or the antibody level is something to the effect is 25% of 17-year-olds. You want to talk about?
Yeah, so there's several studies now because we've been doing this for 20 years,
yeah.
15 to 20 years depending on where you are in the country. 20-year-olds, only 24% have immunity. A recent study just showed that if you give those teenagers a booster, it works. Mm-hmm. So expect there'll be a recommendation soon for adding a booster for hepatitis B, when really all we need to do is change it back to the teenagers who are about to be sexually active, for example. Then they have lasting immunity because their immune system's more developed. Makes complete sense.
Yeah.
You're a big enough person that 250 micrograms of aluminum is not as toxic either.
Right, there's enough neurodevelopment there that you're not going to affect these pathways.
And neurodevelopment is well along its way.
Yeah, I remember when I was 9 years old, that's when Hep A, Hep B, Hep C came in. So when I was 9, 10, 11, we had to always go to the doctor for that. So yeah, that newborn, I didn't realize that amount of aluminum was in that as an adjuvant. So
right.
Let's kind of talk about this personalized approach. So that's one global, because you like vaccines. We'll talk about HIB,
right.
one of your favorite vaccines
right.
from last
right.
time and so forth. What we're seeing in medicine in general, with adults and so forth, this personalized approach where we're looking at genomics, environmental susceptibility, genetics and so forth, and trying to figure out the best plan, whether it's lifestyle, medicine, whatever. But then when it comes to infants, it's like there's the cookie cutter one size
right.
fits all approach, which you talk about in the book and on your YouTube channel is not the right way to go. So
right.
how do we customize the vaccine approach so that we're helping folks that have high risk, that have parents with autoimmunity and so forth? Let's kind of talk about that.
So this is the area that we sorely lack good studies. So you have to really dig and find them. There are studies that show there's an increased risk of autism if you have inflammation in the womb. Okay, so one can extrapolate, and there's another study that shows there's increased inflammation in the womb for those who get a flu shot. So just add 1 + 1 = 2. If the flu shot causes inflammation, one study. If inflammation triggers autism, increased risk, another study. Perhaps we shouldn't be doing flu shots to pregnant moms. Now they should do a bigger study, but there's an example of how you need to take the data and individualize it. But to speak to genomics, I'll just use one example. There are thousands, hundreds of thousands of single nucleotide polymorphisms, and a lot of great people doing some good work in that area. I know you've worked with Ben Lynch. He's just come out with an amazing program that will help people get their 23andMe analyzed. And what I really like about what he's doing is he's not ignoring the fact that there's a major factor that comes from your environment, from your food, from the toxins you're exposed to. And of course, as my book outlines, we need to also take into consideration the toxins that are in vaccines. Mm-hmm. The elephant in the room that we call autism, it's not just autism. There's no one autism. There's toxicity that's affecting actual brain development. There's toxicity that's affecting your immune system. There's this new condition or a relatively new syndrome called ASIA, autoimmune syndrome induced by adjuvants. Mm-hmm. The main adjuvant in vaccines is aluminum. Yeah. So lots of studies in the last 5-10 years showing that aluminum triggers autoimmunity. And there's a connection between autoimmunity and brain problems. MS is one that we're very familiar with, but autism might be, there's a subset where there might be an immune mechanism going on. So it's time to get away from one size fits all, as you were pointing out, and allow families to individualize the approach. You know, parents know best what their risk factors are. I mean, obviously they want to share these with their doctor. So let's say you're a parent and you come to me and you say, you know, Dr. Paul, I'm a homozygous for the MTHFR defect and my wife's a carrier, so our kids are 50-50 going to be homozygous. Just that defect alone tells me we have extremely higher risk for toxin damage, and I probably wouldn't give a child like that, if it were me, any vaccines, at least not until I'm sure that this child's going to be okay. Right? Now that's a crazy statement, right?
Right.
It's like, what do you mean? or let's just say you already have an autistic child.
Yeah.
Now you understand if your next child is a boy, their risk is about 1 in 5, and it's at least 1 in 20 compared to the going rate, which sadly is 1 in 45 or 1 in 67, depending on the study. But the risk doesn't have to be that high. So I present in my book some data. The research was approved by a Western Institutional Review Board because it was a retrospective look at our experience in my practice. And it's very interesting. Family history is a huge risk factor. We've known that. Not vaccinating at all, especially when you have risk factors, reduces your risk. The main part of my study broke my practice. The group that we were looking at was kids who were the age that entered my practice when I started Integrative Pediatrics, which was in 2008. And we picked kids who were at least 2 years old, and up to the time of the cutoff of the data bank, they would have been 7. So they were ages 2 to 7, average age of about 4.5. Most of the severe autistic kids would have shown up by then. And group 1 was those kids who vaccinated in the vaccine-friendly plan manner. A selective approach where you don't do the Hep B if you don't need it. You only do 1 aluminum-containing vaccine at a time. You wait until age 3 for the MMR. You wait on polio, and you don't do the rotavirus. That's sort of in a nutshell. And we had no new cases of autism or autism spectrum out of over 1,000 kids who vaccinated that way.
Wow.
In the unvaccinated group, which was 238 kids, we had no new autism or autism spectrum. In the third group, now this was a bit of a hodgepodge group, so you can't extrapolate too much from it because these were kids who, some of them joined my practice because they were starting to get nervous about seeing some little glitches. Some of them got the Hep B as newborns, which isn't something I recommend, so that threw them into group 3. But we had 15 cases of autism or autism spectrum out of almost 900 kids. It was a rate of 1 in 60. Pretty close to the going rate out there. By the way, the significance for group 1 doing the vaccine-friendly plan way of vaccinating had a p-value of 0.00001.
Wow.
You don't get much more power than that.
Yeah.
That means for people who are not, statisticians, which I actually am not. I got help with my statistics. But that means the chance that could have happened just by random chance was 1 in 100,000.
Wow, that's amazing.
Fairly significant.
Now, let's for our listeners that may not be familiar with your practice, you have I would say a higher risk population, right? I mean, people are seeking you out because of your different approach. They might know internally or have some hunch that, they were referred by a friend or what have you. So that's really unique in the sense that, it's that statistically significant that the vaccine-friendly plan, again, it makes a lot of sense. You're using informed consent and so forth.
Yeah. For your viewers, the reason I even started this practice was I had a last straw incident in November of 2007. I walked into an exam room, and right in front of me was supposed to be a healthy 2-year-old visit, a well child visit. And I had a little fellow, I'll call him Jack, and he's in his stroller just looking like this, and there was just no, and I'm like, Jack, I can get kids to interact. Yeah. Jack. There was no one home. He was gone. And I looked back through the chart, and he'd been normal at 1. He was starting to talk. He was, normal in every sense of development. He had lost his eye contact, lost his language. He was gone. That was the 4th kid in 4 years in my practice who had gone from normal at 1 to severe autism by 2. It was the last straw for me. I knew better. When you know better, you can do better. And I think sadly a lot of people just have their blinders on, and it's, one size fits all like we were talking about, and they just don't know better. And I'm hoping that this book will kind of open people's eyes. I mean, this is a well-referenced, over 300 peer-review references that are, talking about all the issues. This isn't an anti-vaccine book. I give vaccines every day in my office. One thing that I noticed in my study, when we did our chart reviews, we looked at every single visit in the chart. This was a very labor-intensive, took over a year of 3 different medical students spending summers and evenings. I mean, we really poured through these charts. And something else we do in my practice is if you start to see developmental delays, you stop all further vaccination. I've had so many patients join my practice who their pediatrician says, oh no, there's no link, just do them all. And even when the child's starting to show signs of a problem neurologically, they're continuing on. And it's reckless. So we had in our group 1 who followed the vaccine-friendly plan, 3 kids who were starting to look, headed down that autism road. Mm-hmm. They weren't quite severe enough to have a label or a diagnosis. And by stopping, they ended up being completely normal.
Wow.
In our smaller group that were more heavily vaccinated, we had 5 such kids who ended up fine. Mm-hmm. These are kids who I have no doubt would have progressed on to autism if we just kept hammering away and dosing them with more toxins. That's an example of individualized medicine in the simplest of forms, mm-hmm. right? I mean, you have to take each child in front of you as an individual and tailor what you're doing to what you're seeing. Right? I mean, examine the patient. It's good medicine. Examine the patient. Mm-hmm. It really makes me sad that we seem to be losing informed consent. When I was in medical school back in the age of the dinosaurs in the early 80s, we were hammered by our professors about informed consent. You do nothing to a patient until you have explained explicitly the risks and the benefits of the procedure. You also need to explain the alternatives. And in the case of vaccines, which is a procedure, you're injecting something that can have ill effect, right? Potential benefit, potential side effects. One of the options has to be not doing them. Well, when you have mandates, your viewers probably understand that in California this year, July 1st, 2016, if you live in California and you don't do all the CDC vaccines, you can't go to school, daycare, whether it's private or public.
Wow.
California just released a study last week. They have 97,000 children with an autism diagnosis in the public school. They have a 7 times 600% rise in autism since 2001. They have kindergartners this year compared to last year, 17% more autistic kids. The crisis is just exploding. It's like people. It just baffles me that people aren't willing to look at all the science and use some common sense.
Right. And there's so many variables from environmental toxins, GMO foods, and so forth. So if we know we have control over this variable, being the vaccine and the toxins in the vaccine. So why not minimize exposure?
Right.
But I have 2 questions. The first one is for the people that are into the herd immunity. And when they hear, oh my gosh, you're not vaccinating, they get really reactive. I notice this particularly online.
Yeah.
Talk about this, like the rates of polio, and stuff like that.
So herd immunity is this concept that if we vaccinate enough in the herd, in this case the human herd, then if the disease is introduced into the herd, it can't take hold. It actually has some validity. I mean, if you think about measles, that's the one that scares everybody, right? We had the Disneyland measles epidemic. Yeah. That was the whole rationale for mandating vaccines in California. There were less than 200 cases of measles tied to that epidemic. But in the whole country, there were less than 800 cases, if I'm not mistaken, in 2014 when we had this epidemic. The usual flux of measles in this country is 200 to 800 over the last decade plus. There have been no deaths in the United States. That's an example of herd immunity working. So in Oregon, there was one man who caught measles from Disneyland. He was 40 years old approximately, lived in one of the bigger towns in Oregon. Not a single person caught measles from him. That speaks to how well the measles vaccine works. So people are going to say, well, Dr. Paul, you clearly have disregard for the public if you're going to be anti-vaccine. No, I'm not anti-vaccine. In our vaccine-friendly plan, we do the MMR after age 3, as long as it's safe to do so. There are families who have, it's just too risky. But there's some interesting data. In fact, the data that was presented by Dr. William Thompson, the whistleblower for the CDC, actually showed it was safer to give the MMR after age 3. Now, when I opened my practice in 2008, I picked 3 as a probably safer age, not knowing this data, because that data was hidden. But I did it for this reason. I had seen with my own eyes in my own practice 4 kids deteriorate after the MMR. And the rationale I thought was, well, if the neural networks are established, which is usually by age 3, kids are talking, they're very connected with their world, maybe, I was just hoping, that if if the MMR is causing mischief, it won't be as bad because the brain is all well set. It seems to have worked out. I'm not saying that we don't need more studies. We definitely do. But I have a feeling that it'll be safer to give that vaccine at age 3. You still maintain herd immunity. So if a case of measles comes into the population, people are still vaccinated. You're going to say, well, what about those who are under 3? Well, what about autism? You know what I mean? So you have to somehow use science and common sense. You mentioned polio. There hasn't been a case of polio since 1979 that was acquired here in the United States. Basically, polio is transmitted through drinking water that was contaminated, the lack of good water. That's not a problem anymore in the United States. It's not going to be a problem. We don't need to worry about polio. So you have to take each vaccine one at a time, and that's what this book does. This book will take you from Chapter 1, which is all about toxins, because really it's not just vaccines. I think people get, when they hear the vaccine, anything, people are polarized, right? Totally. You're pro or anti. Let's get rid of this polarization and just be scientific, right? We start with pregnancy after dealing with toxins, and in pregnancy, keep it sacred, including minimizing stress. And then the book walks you through each age that you would see a pediatrician so that you know and you're armed with what to do. When you go into the pediatrician, you're going to know what they're expecting you to do as far as vaccines, but everything else. All the normal growth and development is covered, the common childhood illnesses are covered, but in the vaccine arena, we address each disease, the risks, the benefits of doing the vaccines, and try to make common sense decisions based on all the literature that's out there.
Yeah, this is really a primer for parents of all.
Absolutely.
You know, it's what to get after you get what to expect when you're expecting. It's like the follow-up book, really. I mean, I was telling Sam in the car, because it goes through everything from colic and, oh, my baby has a rough throat when they're breathing. I mean, all these things for new parents, it kind of freaks you out. Yeah. At least the first go around. The second go around, you're like, they're going to be fine, right? But so that's really fantastic. Now, one thing that I remember from the book was pediatricians generally are really, like to follow the CDC rules and so forth. And if a pediatrician gives a parent a hard time for wanting to go follow this vaccine-friendly plan, your advice is find a new pediatrician. So talk about that empowerment, because a lot of people are scared by their healthcare practitioners.
Right. Just talking to one of my staff members who has a friend who just went through this very thing, being threatened about, kicked out of the practice. She's vaccinated her previous 4 kids completely on the CDC schedule. Her 5th kid is having some problems and she wants to slow it down, and she's being threatened with being kicked out. I get patients every week who've been kicked out of somebody else's practice because they won't follow guidelines. Yeah. Why are pediatricians doing this?
Risk, probably, right? Liability?
So there's a number of things. Yeah. The biggest driver, I think, is ignorance and misinformation. However, pediatricians are good people, and they really care about people. I went into the practice of pediatrics for that reason. I loved all the pediatricians I saw. They're family men, women, they love kids. They're trying to do what's right. And when I was a new pediatrician, I figured, well, how could I know more than the CDC? No way. I mean, all the smartest doctors are there at the CDC. What's become apparent is that there's some conflicts of interest at the level of the CDC. And as a result, you really have to think independently. You can't just rely on CDC guidelines. The hepatitis B is that perfect example. They have the information. It is long past time that we're still injecting newborns with hepatitis B vaccine who don't need it. So clearly there's something going on, conflicts of interest. Time for pediatricians to think for themselves. Well, then why are they still doing this? It turns out there's a lot of pressure to follow guidelines. And this pressure is now coming forth in the form of quality measures. You see, a health plan will say, we're going to be looking at your rate of vaccination. And we're going to look at 2-year-olds and see how many of your patients have gotten all their vaccines that they're supposed to have by age 2. Right? And if you don't meet a certain standard, let's say it's 70% or 80%, you're a bad doctor. And you're going to actually lose your bonus. Okay, or we're going to cut your pay, your reimbursement rate, because you're a bad doctor. So now it's hitting doctors in their pocketbook, and office overhead has gone through the roof. So now it's actually survival. And you'll have office managers pushing, we got to do this, and setting up office policies to make sure everybody's getting vaccinated. And there's all this pressure, And I think people, pediatricians, they're just not paying attention to the fact that, wait a minute, why are we giving hepatitis B to newborns?
Right.
You know, so it's complicated. I don't think there are bad people out there. I think they're just under all this pressure to do what's right in the name of public health. You know, it sounds so good. We're going to have a public health and quality measure improvement process in our office. We're going to make sure we're the best we can be. And the number one thing for a pediatrician to look at is their vaccine rate.
Now, you said, is this pressure from insurance companies or reimbursements?
Yes, at times.
Okay.
Yeah, at times it's from insurance companies. The other thing that's happening in California, for example, the only way to get an exemption is if you get a medical exemption. And what they're doing there with their new law is there's a real pressure. Any doctor that's giving a lot of exemptions, they're feeling the scrutiny of the system. So even the schools are not wanting to follow through with medical exemptions unless they are per CDC guidelines. So now Big Brother, CDC and government, is not only behind making the rules that you can only have a medical exemption, they're going to tell you what kind of a medical exemption. So if I'm your doctor and I know your MTHFR status and I know your autism, you have 2 kids with autism, your risk is through the ceiling. You should not give the one-size-fits-all vaccine plan. But that's, the CDC doesn't see that. You know, the only thing that qualifies in their mind is allergic reaction, you know, severe autoimmune issues, right? So it's complicated.
Yeah, so what tips do you have for a pediatrician listening right now? Hopefully, you know, folks listening would share this with their pediatrician. If they want to like use a sensible approach like you've laid out in your book here, what do they do? Because like you said, there's pressure coming from all angles here.
Yeah, you know, pediatricians, it's time to stand up. We have got to return to informed consent. We've got to be science-based. We can't just follow guidelines without really thinking about what we're doing. And, you know, I would urge you to avoid contempt prior to investigation. You know, I was once just like every pediatrician. I totally believed everything that came out of the CDC. And when I started doing a little deeper digging, wow, there's a lot of information out there on the toxicity of mercury, the toxicity of aluminum, Asia, the new autoimmune syndrome induced by adjuvants. I mean, the lists just go on. And then to find out, for example, what was in Vaxxed, that the CDC knew in 2002 when they were charged to do the study that looked at the MMR vaccine in autism by Congress, they found data that showed there was a link. Well, they couldn't publish that. So they did some maneuvers to get rid of that finding. And they published a study in Pediatrics in 2004 that showed no link using the very data set that had a link. Now that should be criminal. Now, of course, I don't have privy to the 1,000 pages that have been submitted to Congress. So for pediatricians, before you pass judgment, and I'm not passing judgment either, let's get Dr. William Thompson subpoenaed in front of Congress. He said he wants to testify. Let's let him testify. This is bigger than Watergate.
Right.
I mean, this is huge. If there's a link between vaccines and autism that's been hidden from the population while the autism rate skyrockets, we have over 1 million autistic kids in the last decade. Almost 100,000 in California public schools now.
It's incredible.
They weren't there. When I was in medical school in 1981 to 1985, guess how many cases of autism I saw? None. You've interviewed me before. There were none.
Right.
In residency, I saw a handful of mild cases of PDD-NOS, pervasive developmental disorder, not otherwise specified, which is what we would call autism spectrum today. And today it's just, it's out of control.
Yeah, it's really scary stuff. That would open Pandora's box, you know.
We got to do it.
Yeah.
We've got to do it. I mean, at some point we got to stand up for real science and not allow. There's a lot of research being done that's sponsored by pharmaceutical companies, and their interests are to show benefit, right? So you do little tiny studies, and when you get one that shows benefit, you publish it. You think about if we looked at tobacco that way, and we compared a pack-a-day smoker to a 2-pack-a-day smoker, and we looked at them 6 months and a year out and looked for lung cancer, we wouldn't have found anything. See? Smoking's safe.
Right.
It doesn't work that way. we need better design of our studies.
Yeah, absolutely. So just to kind of summarize as we finish off here, you know, for folks, this is a really personalized and customizable plan that you can kind of piecemeal together that you've laid out in this book here, the vaccine-friendly plan. And basically what I heard you say there, Dr. Paul, and correct me if I'm wrong, that if your child is high risk, autoimmunity, and you see some developmental delay, slow things down and personalize the approach. And if you go off, don't vaccinate at all, especially the aluminum-containing vaccines, there's enough herd immunity that you're at very low risk. And look at each vaccine and which disease it confers benefit against individually, and the risk reward benefit.
In a nutshell, you're right. And in the appendix, we actually have the vaccine-friendly plan outline that we've used in my practice. We have, in this particular study and data, over 2,000 patients who've done very well with this. But, you know, I think there's a lot of nuance that's written into this book as well, so you can't just take a prescription from an appendix. You really ought to read it, because there's situations where I think it's very clear you should avoid this particular vaccine ingredient or this particular vaccine. And you know, I did my best to bring that research forward, and we need more.
Totally.
Yeah.
Yeah, that's awesome. Well, speaking of research, I know you spent a lot of personal time. I remember, like, on Sundays we would talk about other things and you were diving into the research. So a couple final questions here is morning routines. That's the first question. And we know that busy practitioners and influencers in our community have a morning routine. This is more, we're getting personal here, Dr. Paul. So what do you do in the first couple hours of your day that's special or unique?
You are getting personal, aren't you?
Yeah, well, I get to know you.
So I have a new kitten. And the damn thing, oh, sorry, you can't say that
It's all
on the
good.
video. Wakes me up way too early. No, that was just recent. I start my day every day going through the world literature. I have a few listservs that I subscribe to where I get all this data, and I scan the abstracts, and if it looks like, oh, this is important. And I'm not saying that other things aren't important, but I'm saying important for the world of preventative health, pediatrics, having babies safely, avoiding toxins, vaccines, you know, in that arena. And I will save the abstracts that I need to read the full article and go through that later. Sometimes this year I wrote my book, and so I've got over 1,000 saved articles that I have to get to.
Yeah.
But I read the abstracts, so that's the first thing I do. And then starting real soon, I'm purchasing a enclosed bicycle. We live in the Northwest where it rains. I'm anticipating the rain's coming.
Yeah.
I'm gonna leave extra early and pedal to work. So
Cool.
I'm gonna ride my bike. It's about 6 miles, but a lot of start and stop because it's city.
Yeah.
So I'm gonna get a workout because this bike is heavy.
So it's covered, so when it's raining, that you're
Won't
not
matter.
gonna get wet.
Yeah.
Wow.
So
Is
that
this
way
a
I
new
can-
bicycle? I haven't seen
It's
this.
called an ELF.
Okay.
Yeah, you
I'll
can
have
look
to
it
check
up
it out.
online. Yeah. So I'm gonna add. Because I've been too busy, first with raising 10 kids, and then with my huge practice and writing a book, I've neglected exercise a bit more than I wished I had, so I'm going to add that in.
Yeah.
I think that's important. And then, you know, a little bit of meditation would be good. I'm a little weak in that department, but
Yeah.
I need to add a little spiritual and meditation component for sure.
Sure. That's awesome. Yeah. So the research is a big component of your morning, it sounds like.
Very much so.
Yeah.
I don't feel like I started my day off right if I breeze past that. I just don't want to miss anything.
Yeah.
And I'm sure I do miss things. You
Totally.
can't keep up.
Yeah.
There's so much information. And I think a lot of times busy physicians in the trenches seeing patients, I mean, my practice has over 13,000 patients. Sure, we're a team, but they're my patients. We don't get a lot of time to read. And so we end up relying on the CDC to sort of encapsulate for us, or the Academy of Pediatrics. And, you know, they do a pretty good job in some areas, but when it comes to the particular issue here with the vaccine-friendly plan, where you're looking at neurological issues, autism, and vaccines and toxins, there's a lot out there, folks, that you just miss. It's not being brought to your attention.
Absolutely. What I've noticed doing consulting work in the doctor space for the past 10 years, what really separates the integrative functional medicine practitioners from the general insurance-based Medicare, type folks is that self-study, that wanting to sharpen the saw and look deeper. And so it's really unique in that, like you mentioned, a lot of practitioners just don't have time. Like if you don't make time to study, you're not going to get the time.
Yeah.
So I like
I would encourage other practitioners, You know, when you're just following guidelines like I used to, medicine can get pretty boring, really. I mean, it's cookie cutter. Anybody could do it.
Yeah.
But when you delve into the research and you become integrative, you become a functional medicine type doctor or an integrative medicine, you incorporate other practices, naturopathic, etc., it gets exciting because not only are you now addressing root cause instead of just treating symptoms, but you're helping people get better. I mean, every day I'm getting stories where people have seen all the specialists, mainstream, they're not getting anywhere, they come and we start figuring it out. It's exciting.
That really is exciting. Yeah, there's computers and robots that can do this algorithm-based medicine.
Right.
So if you're practicing that model, it's obsolete. You better start, doing more functional
There you
based.
go.
So speaking of functional medicine, what's your favorite herb, nutrient, botanical, or whole food? So you're going to go live on a desert island. Vitamin D and omega-3s are covered. You can only take one thing with you. What would it be?
Oh, wow. So you hit my two favorites, vitamin D and omega-3s.
Yeah.
You got to have those. So what other nutrient? Well, I would say if you have the genetics that too many people have in this country, which is the MTHFR defect, you've got to have methylfolate. But I don't know. There's so many antioxidants that are so important. You know, vitamin C, quercetin. There's a lot.
There's a lot.
There's a lot.
But you personally, because you've shared this before, you have the MTHFR SNP. So for you personally, folate would be up there.
It needs to be methylfolate, though, for the most part.
Yeah.
Yeah.
And for parents listening, for kids, I know you probably do injectable methylfolate. Efficacy or the effectiveness of oral versus injectable, what have you found for children?
So actually, I have not delved into the injectable methylfolate a lot. I've done some injectable B12. I have found that if you push the methylfolate high enough, it often works. But there's folate trapping. I mean, it's a complicated issue, and I'm not really an expert per se, not like, say, someone like Ben Lynch who really understands all those pathways. But this is a really important area of research and study. Yeah.
Fantastic. And if folks want to learn, we've done a couple interviews with Dr. Ben Lynch, so they can find that on the link below this video. But Dr. Paul, final question here. If you were to bump shoulders with someone from the World Health Organization or a future president, just had 30 seconds to bend their ear in an elevator, perhaps, what would you want them to know and why?
I would ask them to read this book, to be open-minded to the fact that the current direction we've been on with the World Health Organization and the CDC is very myopic. I mean, it's basically vaccines are safe and effective, period, and we're ignoring all the potential side effects. I love vaccines, but we have got to change this one-size-fits-all because we're doing more harm than good, I believe. And, if you can't change, I cannot unsee what I've seen, right? I can't unknow what I know, but I can unlearn bad information. And this is what we need. We need to start learning what's really going on and start getting rid of some of the bad information that we've accepted. Paradigm shifts are hard. And I think especially for the World Health Organization and the CDC, their whole basis of existence is preventing infectious diseases, right? It's like, so you go to war to prevent infectious diseases, you use vaccines. That's your weapon of choice. Nothing wrong with the weapon for certain particular fights, but we've overused this weapon to such an extent that the collateral damage is just ridiculous. And so I would just ask you as a person in power, whether you're the president or somebody in a high level at the CDC or the World Health Organization, kids are hurting. People are hurting out there. When you over-vaccinate and you overtax the immune system at a very young age, you shift people towards allergy and autoimmunity. And the chronic diseases we're seeing today are partially due to that very issue. So we've got to change what we're doing. We've got to individualize medicine. We cannot do one-size-fits-all medicine anymore.
Would you be more, this is kind of just came up, right? If the vaccines didn't contain the adjuvants like aluminum, for example, would you be more open to, say, MMR perhaps or other vaccines?
Well, MMR doesn't have aluminum.
Okay.
Its challenge is complex. I think very potent 3 live viruses all in one for one thing. But let's just take the Tdap. All right, diphtheria, tetanus, pertussis. It has a pretty high dose of aluminum. For a number of reasons, that vaccine isn't very effective anymore. Okay, there's the protactin protein. We're finding that the organism has mutated and shifted so that the vaccine doesn't even work a lot of the time. But on top of that, it has all that aluminum. So there's a couple problems with it. Let's rework it. You know, I really think for the vaccines to become safe and effective, that little cliche, we have got to put liability back into the equation. If insurance companies were liable for the damage their products are causing, they're going to improve their products.
Right.
So unfortunately, a long time ago, we did a misguided thing by removing liability. I understand why it was done. It was felt to be in the interest of the safety of the country, but it's backfired. So we need to put liability back where it belongs, go to individualized medicine, get rid of mandates, return to informed consent, and it's going to be okay. You know, this is the problem. The sky's going to fall. We're going to have all these diseases return. No, they won't.
Right.
They won't. I mean, there might be a little case of measles here or there, right? An occasional death. I'm not saying that's nothing for that family that loses somebody, but if you're looking at public health, you've got to look at the whole picture, right? What's the damage, the collateral damage compared to what we're preventing?
And the long-term damage in terms of care, in terms of,
I mean, our world is in a crisis with cancer. What's that about? Okay, well, that's immunity. It's our immune system that prevents cancer. And if you're affecting your immune system negatively through toxins, and vaccines are a piece of the toxic puzzle, as well as too many, too soon, too fast against an immature immune system, triggers shifts, maybe we've got something there as well. So I would love to see the CDC and the World Health Organization take their focus off of just preventing infectious diseases. That was a century ago.
Right.
And shift it to health and wellness.
I love it.
If we shift our focus to health and wellness, we can change the world.
Well, thankfully, we now have a tool to do that. Your book, The Vaccine Friendly Plan. Dr. Paul Thomas, as I mentioned before, it's really an honor to sit here and speak with you, and so great to see this manifest over years of working and knowing you. So commend you. Keep up the great work. As we kind of part ways here, you have a couple different you have a wonderful YouTube channel, which we'll have below this video if people are watching this and on the show notes in iTunes. But people want to connect with you. What website should they connect with you on?
So I have a website, drpaulapproved.com. It's relatively new, but this is the website I'm going to grow to be able to connect with patients and just people who are interested. I'm already putting up the references from this book will be available in as much as I'm able to do so, right, legally, so that people can actually read the abstracts that are referenced in this book. And in my reference section will have tabs developed for each disease that can be possibly prevented by vaccines. There'll be tabs on aluminum, on mercury, HPV, any vaccine, and I'm going to work real hard to keep those up to date. And they'll have the most recent articles at the top going all the way down through the literature. So that'll be a free resource available, and there will be other resources available on that website as we develop it. Awesome. I'd say that's probably your best bet. For people who are just curious about my practice, and please, I am not looking for patients, we're slammed, but drpaul.md is my regular practice, and there's just a boatload of information there as well.
DR Paul approved, and I think there's, 50 pages of references here? It's over 407 pages, I counted.
Yeah, over 400 pages.
A lot of content.
Yeah, over 300 references,
yeah.
Most of them peer-reviewed studies. I think this could be a very important book.
Absolutely. Well, keep up the great work. It was an honor to speak with you again.
Thank you so much. It's an honor to be able to talk with you.
Fantastic.
Take care.
Thanks.